Hi, this is RxHelp, advice from a person on the other side of the pharmacy counter. I know it's been a while since I have recorded anything for a variety of reasons, but today I would like to talk about prescription naloxone. Not a lot, but states little by little are starting to pass regulations to allow for the walk-in prescribing and sale of naloxone. So I kind of wanted to go over what it was, what it's used for, and why it's an important thing, at least in my opinion. So naloxone is it's a competitive opioid blocker. Basically what that means is if a person is overdosing on an opioid medication like Percocet, Vicodin, and even heroin, if you give the person naloxone, it will stop them from dying. Every body has these little things throughout your body called receptors, and it's like a keyhole. And the opioid, which would be the Percocet, Vicodin, possibly heroin, is like a key for said keyhole in your body, and it fits in there real nice. If you have too much and it's filling up too many of these keyholes, it can lead to you passing out, your breathing slowing way down, and you possibly dying because it just overloads the body. So what naloxone does is it gets in there and it gets rid of the key because it is a stronger key and a better fit. And so it kicks out the pain medication or the heroin or whatever the opioid is that is in the person's body, overloading them. And it basically stops the body from dying and overdosing. And it's a really good thing. It's an agent that has been available for a while, and it does wonders when a person is overdosing. Now, on the same token, it does throw them into immediate withdrawal, which can also be very harmful and potentially deadly. So when you give this product, you're supposed to either be in a hospital setting or be calling 911 when you're giving it, so that the person doesn't die from withdrawal, because that is a potential that can happen, especially if a person is addicted to the substance that they're overdosing on. So it's very, very important to keep that in mind. So basically what some states have been doing little by little, my particular state has passed this law recently. They're not the first. They certainly won't be the last. I foresee this happening throughout all 50 states eventually, or federally eventually. Basically, a person can walk into the pharmacy, much like when you walk in and ask to get a flu shot or a Tdap for pertussis and tetanus and stuff like that. Much in a similar fashion to that, a person can walk into the pharmacy and say, "Hi, I need a naloxone kit for overdose protection," and the pharmacy fills it and sells it right there. Whether or not the person's insurance covers it is a different story, but it is available for purchase to the person. Now, the person does not have to be the person who's going to be using it. It could be, especially if the person knows that they are rehabbing, they are likely to find themselves in that situation. That's wonderful that they're taking that step to help prevent themselves from overdosing. They're admitting that they have a problem and need to have that on hand just in case. But it's also available to be sold to people that know there's somebody that it's either in their household or that they're going to be around frequently that has the potential to run into this situation. So say a family member, their family member just got out of rehab and they know that they are likely to go through relapse again. That happens so frequently. I don't know the exact percentages, but it's a very high percentage of people that will relapse after they get out of rehab, usually within the first couple weeks that they're out. That's when they're most likely to relapse, and that's when they're most likely to overdose, because they have rehabbed, meaning the product is no longer in their body, they are no longer physically dependent on it. So if they go back to using the product, they're more likely to run into overdose situations because their body is no longer used to the product. The addiction is a mental thing, not a physical thing anymore at this point. So when they go back to using said product, if they go back to using said product, they're more likely to overdose because their body is not physically used to it anymore. It's available for purchase for family members or friends or whoever to have on hand in case that person does run into a problem where they overdose. So, it's a really great option to have if you need it or if you know that that's going to be an issue. So basically, the product, Naloxone, does come in a couple different forms. It comes in intravenous, of course, but you're not going to see that for sale in a pharmacy. You'll see that in hospital, and that is the preferred method because it gets to the sites fastest. It's going directly into your bloodstream. But you're not going to see that in pharmacies out in the community. The ones that you will see are the injectables and the intranasal. So the intranasal, it comes in a little atomizer, makes it into a spray, much like Nasonex and Flonase and saline spray, and it goes directly up into the body and gets absorbed through the nasal passage. And then there's also the injectable. The injectable comes in two forms. It comes as an auto-injector, kind of like the EpiPen and the AuVQ, where it's ready to go. You just take off the cap and ta-da, you can use it. Or it comes in the form where you have to draw it up. It all comes down to patient preference or person preference, if it's not the patient themselves. It comes down to personal preference, what they think would be easiest for them to use if that situation occurs in the moment. Most people will usually choose either the auto-injector or the intranasal, just because it is the easiest. You don't have to really think about it. It's ready to go, especially with the auto-injector. And it's very simple to use. A person with no medical knowledge can use it because it's simple. You just have to train the person on how to use it if need be, and that's what pharmacists are there for. In fact, in my state, it is legally required if we dispense one of these for the pharmacist to do counseling with the person that is purchasing it, to go over how to use it, when to use it, if it's important, the other things that are important, because it's not just you give it and the person's all better. Like I said before, it does cause them to go into immediate withdrawal, so you do need to have 911 on the way. And the other thing is that after a while, it will go away. The body will use all of it and it will dissipate. And if the person has a long-acting form of an opioid in their system, like OxyContin or Opana or fentanyl, something that is very, very long-acting, if they're overdosing on that, it will go back into those receptors, the little keyholes in the body, and the person will go back into overdose mode. So each kit comes with 2 doses in case you do need to give a second dose, like if 911 hasn't gotten there and you need to give a second dose because the person is going back into withdrawal. So I just wanted to go over that, since that is starting to be an initiative that we're seeing more and more states are passing the okay to give it without a prescription, little by little. I honestly think it's a good thing. I don't think it's a good thing that it's a necessity, but I do think it's a good thing that the person doesn't need a prescription and that it doesn't need to be the patient themselves getting it, that it can be a patient's loved one. I think it's a good thing to have available. The reasons behind needing it available are sad, and I hate knowing that that's so common of an occurrence that it's become a necessity, but it is a very good option to have. And I do agree with it that it be available for purchase without a prescription. So If you have any more questions about it, definitely leave me a comment, drop me a message, connect with me on Twitter, whatever it is. Feel free to reach out to me. You can always reach out to your local pharmacy to see if it's an option where you are. If you find that this could be something that you potentially need, or somebody you know could potentially need, speak with their doctor to see if it'd be something that you think would be a good thing to have on hand. Even people who aren't necessarily addicted but do have a need for opioids for chronic pain conditions, it may not be a bad idea to have it on hand, just in case that person, for whatever reason, accidentally takes too much, or takes the wrong thing, meaning to take something for breakthrough pain. It's very easy for anybody to take the wrong pill out of the wrong bottle, but when it's a person that has chronic pain medications for their legitimate problems and they accidentally take the wrong pain medication, it can be deadly by accident, completely by accident. So even people who are not necessarily an addict but have a need for chronic pain medications, it may be something you want to discuss having around the house just in case. The other issue is if a child comes into contact with it, or somebody who's not using your pain medication comes into contact with it and accidentally ingests it in place of their own medication, that could also lead to an overdose situation. There's plenty of situations that are not due to addiction that can happen and can send a person into overdose mode when they're not necessarily psychologically addicted to it. They just have accidentally ingested it, things like that. So if you think that, if you have access to opioids in your house and you think that it might be a good idea to have an overdose kit on hand just in case, definitely talk to your doctor or talk to your pharmacy, see if your state laws allow for it. It's slowly getting passed state by state. Find out if your state has that law so that you can have it on hand if need be. If not, discuss options with your doctor as far as how to handle an overdose situation. If one does occur accidentally, it's always a good idea to be prepared when you do have very strong medications in your house. And that goes for anything, not just pain medications. I mean, blood pressure medications can be deadly if taken by the wrong people. Lower your blood pressure too much and you can die. It's not just limited to pain medications, so it's always a good idea to have a plan in mind in case the wrong person comes into contact with the medication completely by accident, but especially with opioid pain medications, because it's one of the most common occurrences of injury and death now in the United States, and it's not all purposeful use. Some of it, I would be willing to say a lot of it, is accidental ingestion. So again, if you have any questions, definitely you can reach out to me. But if you think that this is going to be a scenario that may have the potential to play out in somebody else you know's life, definitely speak with your doctor or your local pharmacist about whether or not this is an option for you. And again, I guess I will talk to you guys next time. I hope you guys are all having a wonderful day, and I will see you next time. Bye.